views expressed on this program are not those of intellectualradio.com, its subsidiaries, or sponsors. Encouraging, educating, and empowering you into action. This is Warriors Talk with your host, Lady ReShell.
Hello. Welcome to Warriors Talk with author and founder Lady ReShell, where we move away from awareness towards action. It is Health and Wellness Monday, and our topic for today is a completely different beast, COVID-19. We are live on Intellectual Radio. We just heard from the Drive at 5 with Roman. Keep it locked right here on Intellectual Radio and allow us to feed your brain. The quote of the day is, "A life lived in fear is a life half lived." We are grateful for our sponsors. We have Gloria Dotson with Mary Kay, catering to all of your beauty needs from head to toe. We have Paula Kelly with Allstate, and she is fulfilling all of your insurance needs in one place. We have MyLeah Symone with your affordable book editing services, editorial services without skimping on quality. And then we have Pastor Michael Richardson with the Emanuel C.O.G.I.C, who has a special message for us.
Greetings, I am Pastor Michael Richardson.
And I am First Lady Anastasia Richardson from the Emanuel Church of God in Christ. We're located at 3058 West Van Buren in Chicago, Illinois. We are building upon a solid foundation.
And we're inviting you to join us every Sunday morning on Facebook Live at Emanuel C.O.G.I.C at 10:15 Central Standard Time. And you can also view our videos on our YouTube channel at Emanuel C.O.G.I.C-MR. Once again, this is Pastor Michael Richardson
and First Lady Anastasia Richardson, and we're from the Emanuel Church of God in Christ. We are building upon a solid foundation.
Here are your trending topics for today. A Chicago family continues to grieve after two young sisters were shot, one fatally while sitting in a car on the northwest side Sunday. A 6-year-old girl continues to fight for her life in the hospital, while the 7-year-old sister has died. The two girls were in a vehicle parked on the street just before 3 p.m. in the 6200 block of West Grand Avenue, when police said someone opened fire on the parked car, shooting both girls. "To say that I am saddened and outraged is an understatement," said the chief of police in Chicago. "I only hope that the residents in the city is as angry, saddened, and outraged as I am at this time. Too many young people have lost their lives to senseless gun violence in Chicago," says the chief. According to a count by ABC7, more than 250 children have been shot and 32 killed so far this year in Chicago. Those are your trending topics for today. If you are tuned in on any form of social media, please like, share the show, invite someone in on the show that you feel may benefit from this valuable information. Joining me today is our special healthy solution expert with over 20 years experience as a family physician impacting lives every day, Doc Michelle. Hello, Doc.
Hi, Lady ReShell. How are you today?
I'm good. How are you?
I'm good. I'm glad to be here to talk about this important topic that we just have to get more and all the information out to the masses.
Yes. It seems like with COVID, it seems like it's never ending. We expected it to go away once we were able to get outside and, lose those masks. But here we are again talking about, and the topic is a completely different beast with COVID-19. So, and I know that we have been given, Dr. Michelle, so many different directives when it comes to COVID-19, wear the mask, don't wear the mask. If you're vaccinated, you don't have to wear the mask. Now, if you're vaccinated and you're inside, make sure you wear the mask. It's like, it can be confusing, and it can bring up trust issues as it relates to the COVID-19 virus, but we're here to give you factual information as it relates to it so that you can have, you can be informed and you can have all the information that you need to make an informed decision.
Yes, so important. And you're right. We are getting so much information seems to be at lightning speed because we are learning sort of as we go with this virus, right? We've never been in this situation. Your show is, the topic is right on target. It's a different beast, right? But I always go back on your show and say we have to trust the scientists that have done the research and the work, right? Because this is new. And so, yes, we've gotten the guidance has changed as we learn more, I like to say, right? Because yes, initially, even if we go back to March 2020, we didn't know as much then as we know now. Back then, they had said, right, we may not need masks. But the more we saw that this was really contagious, then the recommendation was made to wear masks, right? And I know we've talked about this virus before, because even if it hit, before it hit the US, the CDC, the World Health Organization, they could see then that this was a different type of virus, that it was very, very contagious and very deadly. Because the mortality rate, right, the percentage of people that die from this that have tested positive is greater than the flu. The mortality rate for COVID-19 is anywhere between 3 and 5%, depending on the country and the resources. But when we think about the flu, I hate to compare it to the flu, but I think about the flu because that's something everyone, we hear about a lot and getting vaccines. The flu mortality is 0.1%. It's like 0.1 to 1%. So this is 3 times as deadly. It's affecting more people, already over 36 million people in the United States and over 600,000 deaths, right? In 1 year, we may lose 30,000 people with the flu, which is a lot, and we are up in arms about that. We've lost over 600,000 lives in the United States. So this is a different beast. We're going to keep hearing changes as we learn more about it and more and different recommendations. So I don't want people to think that because we're hearing a different recommendation as things change, that it's because they didn't know, right? Or they don't understand. We wait for the data, scientists, we wait for the data, the numbers, all of that, and then we make a decision on what is the right step. And we continue to learn and get more data every day.
Yeah, it could be overwhelming with the information. If you are looking on the internet, anybody can put, out any type of information about it to sway you one way or the other. So I would encourage you to go to the places that's going to give you the facts, like the World Health Organization, the Center for Disease Control, those type of places. They're not biased in their information that they're putting out. So they're going to make sure they put out the facts. So I would encourage you to go to those places versus, different places on the internet that, may not even have any facts behind it. And we talked about that before on the information that gets out, the type of information that gets out. So it could be misinformation, trying to sway you one way or the other. And it could just be flat out. They just don't have the facts. So just make sure that if you're whatever you're deciding to do to protect yourself, that you're informed. So I was reading some of the stats. Go ahead. I'm sorry.
Oh, go ahead. No, I was just going to say, I know we've all had, experience with this virus, either personally, we know someone. And so it really, we need to take it seriously and get, as you said, the information from the right source, because there's so much misinformation, either consciously or unconsciously, but it really is influencing the behavior of people to not wear a mask, to not social distance and those things. But I just want people to get the information from the right place, believe the scientists, know that this vaccine is safe, and that if we don't take it seriously and follow those recommendations, it's going to be very difficult to get through this pandemic.
It really is going to be, we're going to be always in this state for a long time. And some people say, when is it going to go away? Well, we are all not doing our part to make it go away. So, when everybody do their part, then the numbers will get lower and lower. I was watching this video with this lady. It was two ladies that were hospitalized due to COVID. One lady was pregnant. She was complaining that she couldn't see her baby. And the other lady was saying when she came in, her lungs were covered in COVID pneumonia is what she called it. And so it was a guy interviewing her, and he was asking her, now that you have all the facts and, you've been talking to the doctors and stuff, are you open to get the vaccine? Now, mind you, she in this bubble doing the interview because, they couldn't get that close to her. And she was like, no, I'm not going to get it because it's still so, the information out there, it's just, I don't know. And I'm still going to do some research. I'm like, she is in here in a bubble, barely can breathe. And then the other lady that had the baby, she was complaining, and they asked her, are you going to get the vaccine? She was like, no, because I don't know what's in it. And, so I'm not going to put that in my body. And I was just like, oh my goodness, that was scary because it's like you both could, very well be on the brink of death. And here you are, the information is out there. It is out there. Mm-hmm. It tells you, what's in it. But I don't know. I think we get so used to just like the way we grew up and we get information and it's like we don't want to change. We have this stubborn streak about us to where if someone else gives us some different information than what we, conjure up in our minds or our friends done told us, we would rather die than to go with that information. It's really sad.
Yes. It's because, it's hard to change sometimes people's beliefs. And we think that when someone is personally affected, that will change their minds. And sometimes it does, and sometimes it doesn't. We just try to combat that with the facts, right? We go back to how this vaccine came about, that it's been studied before, for years, but it just came the opportunity to really put it in action. And so that's why it seems like it's come about quickly, right? But it's been researched for many, many years. So we can combat those sort of, well, I don't know what's in it, and it came around so quickly with facts. Sometimes it will change people's minds. There's lots of distrust, of vaccines. But we go back to, way back when we got rid of polio and mumps and measles, and all of those things came from everyone getting vaccinated. And there was no way else that we were going to get through those periods without mandating measles, mumps, rubella vaccines, polio vaccine. And now we do that without much hesitation because it's become the standard. It's become the expectation, and we don't really question it. Some do, but we really don't question it. We know those vaccines are safe. Everything has risk. We weigh benefit versus risk in the medical community as well, right? So we try to combat some of those thoughts and those concerns by giving the factual information.
So if you have concerns, the best thing to do would be to talk to your doctor. Do I need to take this vaccine? What are the benefits? What are the risks? Get the information so that you can, so you can make your decision. Don't just, think smart. Don't just go off of, sometimes we emotional about making these decisions, and it's really not an emotional decision. It's a decision about health. Again, I can't say it enough. Get the facts. Hello, ladies. Thank you for tuning in.
Hello.
Yes. So I was reading. I know you mentioned how many people passed. It says overall, the United States has reported 36 million COVID-19 cases since the pandemic has begun. Death-related COVID-19 in the United States has surpassed 617,000.
Unbelievable.
It is. It's a lot. Those numbers, and we know the numbers are rising. We know that they're rising.
Yeah. We were doing really well. We really back in June, I think we had gotten down to about 11,000, thereabout to 14,000 cases in the US, in the entire US, somewhere around mid-June. But then we also knew that Delta variant was out there, right? It wasn't the dominant strain, but once it became more prevalent, we saw that rise just take off. If anyone wants to Google the change, the numbers, you can see that there was a takeoff in the number of cases somewhere in mid-July, in the last few weeks. And that's because this variant is just much more transmissible. And so that's why we talked back in the beginning about the masks, and we wear masks, we don't wear masks, right? Well, back in June, when we were at that low point and the Delta variant was not the prevalent strain, we thought, yeah, you don't have to wear masks because we were doing good. If you're fully vaccinated, chances are that you are not going to get infected and pass it on. But when we got this new variant and we saw that there are people who, even fully vaccinated, could get infected with the virus. And I'm going to stop there because people will say, well, why get the vaccine, right? So the vaccine is 95, 96% effective. There's always going to be breakthrough infection. That's not unexpected, right? It's just that we're hearing about it, right? Because it's prevalent in the news. But you can always, in any vaccine-related illness, you can always get breakthrough infections. We've never said that these vaccines are 100%. So that being said, if you can get exposed to the virus and actually get infected, but you're fully vaccinated, you will probably have mild symptoms or no symptoms. But you can then pass it on to someone, right, who's not vaccinated. And then we start this cascade, right? You'll be fine, but the next person won't. And that goes for the children who still can't get vaccinated, right? We talked before in your program that one of the main reasons for adults to get vaccinated is to protect the little people. We're seeing an awful rise in pediatric hospitalizations and deaths, which should not be occurring. So, if you're out there and you haven't got vaccinated, think about those little people in your lives who can't get yet the vaccine, and know that they are at risk as well, because we're seeing it across the country.
Yeah, they did say the number of the children that's being admitted, we didn't see it at first. And now it's like, at first they said, oh, the kids, they can't get it. That was the rumor going around that people were saying, the kids can't get it. And it's like, yeah, they could be exposed just like we can. But with the Delta variant, it's more contagious. And we know how kids are, they're hands-on. So, this is why the numbers for them are just rising. But yes. I agree. We have to protect them. That was my reason for getting vaccinated, because in my house, mainly I was the one coming and going. So it's like, I know they're not going anywhere. So if anybody was to get COVID, it would have came through me because I'm the one that's leaving the house. So I decided, okay, let me protect not myself as well as my girls that are at home. Yes. So that's what it was about, and plus, I am a cancer survivor too. So, my immune system, was compromised with the treatment. So, I had to make sure just to guard myself, to arm myself with whatever I can to make sure, that if I do get COVID, that I will be able to at least, fight it off. It will be mild. Brenda say, what do you think about pregnant women getting the vaccine?
Yeah, well, the CDC now recommends that pregnant women get the vaccine. And they found that when those pregnant women who have gotten the vaccine deliver, that their babies have some level of antibodies to the COVID virus as well. So initially, they weren't sure if it would be as efficacious in pregnant women, but thus far, from the studies that have been done with those pregnant women who have received the vaccine, they haven't seen any increase in fetal issues, in increased side effects to the mom or the baby at this point. And it's recommended that you get it because you are more at risk if you get COVID and you are pregnant versus getting the vaccine, right? It will be worse for you to actually get COVID at this point, pregnant or not, versus getting the vaccine, because at this point we have seen no deleterious effects from pregnant women getting the vaccine to them or their child, their babies.
So, Dr. Michelle,
so if you're pregnant, they should be talking to their OB-GYN about that too.
Awesome.
Yeah.
So now they're recommending that, people who have, what do you call it, a compromised immune system, they're recommending the booster shot.
Yes.
And
yes.
I don't know.
Yeah, so that just came.
Some people may have reservations about that. I'm sorry, go ahead.
Yeah, no, because so we know that the first sort of group of people who were getting the vaccine way back in January were the healthcare workers and the immunocompromised. And now if we think about it, that was back in January, February. We're about 6 months out from that. And so in order to be sure, because one of the, in the beginning with cancer patients, with patients who have had transplants and things like that, they wondered whether it was safe for them to get the vaccine. But it wasn't about necessarily the safety, it was about the efficacy. Because if your immune system is compromised, you're on these certain drugs that that prevent your body from mounting a good immune response to build those antibodies, chances are the vaccine is probably not as effective, or it may wear off a little bit quicker. And so for that group, especially those moderately to severely immunocompromised individuals, people who have had transplants or on immunosuppressive medications, HIV/AIDS patients, they do recommend it. They think probably at some point the CDC will probably recommend boosters for everyone farther out from the vaccine. And maybe in the fall or winter, I think I read that the next group might be the elderly, the severe elderly group as well. So I would not be surprised to hear about that coming down in the future. Not surprising, considering the longer that the virus is out, the more chance that it gets stronger and mutates. And that's one of the concerns right now, is that we've got to get the majority. I think right now we're a little over 50% of the US is fully vaccinated. 70% have had at least one vaccine. But in order to prevent this variant and this virus from mutating again and again and becoming more virulent and stronger, we've got to get those vaccines in arms as quickly as possible. Otherwise, we'll continue to have this issue with new variants.
Do you think that that the booster shot, that there would be some type of risk? Some people may say, well, I got the 2 shots already. Some people had, symptoms with it, which they went away. But some people may think, is there some type of risk? Now I'm getting this, a 3rd shot, like.
Yeah. Right. So they haven't thus far seen any more side effects from the 3rd shot versus 1 or 2, right? If you got some achiness or the headaches or the body aches, you may have the same thing after the 3rd shot. And again, if we think about flu vaccines that we get every year, right? We get flu vaccines every year because the flu virus changed, right? We have to change how we give, what vaccine we give. If we think about the measles, mumps, rubella shot, right? You get that as an infant, but you also get a booster. You get a booster later, in life. And so it's not unusual to need a booster in a vaccine, especially in a virus that's new and a virus that's changing, that may become more virulent. It's not unheard of at all. And so far, they've seen that the side effect profile pretty much the same as what you got with the first or second shot.
Do you know if one company is working on the booster or all three?
Right now, they recommend the booster for just the Pfizer and Moderna. They haven't come out with any data on the Johnson & Johnson vaccine as yet.
Now, does it matter if, for instance, if I took the Pfizer and then when I go to get the booster, it's the Moderna, does it matter, or should you just stick with what you got the first time?
The current recommendation is to use the same shot that you got the first time, but if that is not available, use the Moderna or the other option. But they recommend, because that's how they studied it, right, was with the same company vaccine.
Now we know that there have been right now they are setting up travel restrictions since the numbers are going up. When the numbers were down, everybody was traveling. Some people wear the mask and some people didn't. And so now it says that the total COVID-19 cases around the world has reached 35.2 million as of August. So domestic U.S. travel picked up considerably in the summer. So we know that the numbers have went up. So now some of the states are they're setting up these restrictions when you travel. Even
so there's a couple of things. Yeah.
I'm sorry, even having you to buy the little test for you to take, the rapid test. But then I heard that the rapid test, Dr. Michelle, was saying that it wasn't as accurate, that you still should take, go and get the regular test too.
So, right. So the rapid test has a little less efficacy than the PCR test that takes a day or so to get back. But a couple of things related to travel. So if you're going to travel, I would recommend not traveling unless you're fully vaccinated, right? That's the first thing, and wear your masks. And you are right. So there are certain states that have very, very high transmission rates right now, right? Florida, Texas, Louisiana. A lot of the states with the high levels are the states with the lower vaccination numbers. But if you're traveling internationally, if you're going down to the Caribbean or you're going somewhere else, you need to make sure you understand what their recommendations are. Most of the time, you have to have a negative test within 1 to 3 days before you travel. And then you have to test before you even get back on the plane to leave, or they won't let you get on the plane. So you make sure that you get that test before, know where you can get a test after. Will they take a rapid? Do they want a PCR? I mean, get those details so you're not stuck. And then, of course, be careful. Don't travel if you're not fully vaccinated. Wear your mask, if you're going into crowded situations. But I just wanted to get that out, because you are right. We were on lockdown for so long that everyone wanted to travel, and who can blame them, right? And we want to be able to travel safely. we just heard about the cruise that had 20 plus positive COVID diagnoses, a Carnival cruise that just came back. So it's, people want to travel. They're doing everything they can, whether there were some unvaccinated people on that cruise and what happened, but we've just got to be safe, or we're never going to get through this. Michelle says, can you get a booster without without a vaccinated shot? Well, the booster is the vaccine, right? It's the same dose, same vaccine, but you're getting a third shot. So the first thing is get your 2 shots. Okay, get your 2 shots from Pfizer, Moderna, or the one from Johnson & Johnson. And then after that, if you need a booster, but at this point, the first thing is to just get the initial vaccinations. If you're otherwise healthy and you're not in those high risk categories, you're not recommended to get a cold booster at this point.
If you are just tuning in, this is Warriors Talk. We're live on Intellectual Radio, and I'm talking with Dr. Michelle, and we're talking about a completely different beast, COVID-19. Now, Dr. Michelle, the kids are starting school. My high schooler start today, and then I have a 4th grader and an 8th grade that's starting on Wednesday. And I know some schools are, they're mandating that you wear a mask. And then I know in some states, like in Florida, they are fighting for the kids not to wear the mask in the schools. And we know that a lot of kids are not vaccinated in the elementary schools.
Yes, I can't understand what's going on in Florida. They've got the highest daily rates right now, over 21,000 reported cases, and that's probably underreported because a lot of people, if they, have mild symptoms, they may not even go get a test. And of course, there's the asymptomatic folks. But yes, so going back to school, it is left up to every district and every state to determine what they want to do. I'm glad that, in Texas, that a lot of the school districts have gone against the governor who said no mask mandates, but schools are making their own decisions to keep those kids safe. Because like you say, you've got a 4th grader, she can't get the vaccine yet. So you have to depend on the adults and the other children who are 12 and up to keep her safe by not getting themselves infected. And so at this point, there is no federal mandate for the COVID vaccine for schools. Schools can make their own recommendations. That may change, in the future. But we're hoping masks are easy. It's the simplest way that we have. We know that wearing a mask can reduce transmission up to like 70%. Putting that mask on over your nose and mouth is the easiest thing. Kids will model what the adults do, right? So if the adults wear a mask, don't make a big deal of it, and just go on about their day, kids will model that behavior, especially the little ones who are the ones that aren't vaccinated. If the parents make a big deal of it and all of that, then the kid's going to make a big deal of it. So we have to model good behavior for them.
I totally agree. I brought hand sanitizer, put it in the car. Every time we go in the store, when we come back out, we put the hand sanitizer on. If I forget, my kid's like, "Mom, did you put on hand sanitizer?" I'm like, "Oh, I forgot." So, that's true. And as adults, we have to set an example for our kids because we're supposed to protect them. So if they see us loose with it, then guess what? They're going to be loose with it, and they probably won't be in your presence all the time. So if they go to school or go over their friend's house, then guess what? That mask may come off. They may not wash their hands. They may be not social distancing. So yeah, as grown-ups, parents, we set the tone in our household. So
yes.
Dr. Michelle, I know that some of the governors were trying to, I know here in Illinois that the governor did. They want the people that are working in like the long-term care facilities and even the ones that are working in the hospitals to get the vaccine because a lot of them have not even gotten the vaccine. And it's like, if you're going to be taking care of these people who already may have compromised immune system, they're sick, they're trying to get well, and you are not vaccinated. So now they're trying to make it mandatory for those individuals to get vaccinated. And a lot of them are having a hard time with it, like saying that they're going to walk off the job, they're going to quit because they don't want to take that vaccine.
Yeah. I mean, private corporations can make their own rules, right? It's not a federal building and nothing like that, but a private restaurant, a private long-term care facility, any of that, they can make the rules. And a lot of them are beginning to mandate the vaccine. And it's a difficult choice, right? Because you want to keep your job, but you also want to be safe. And we know that people want to make the right choice for them, but this is a public health issue of the greatest magnitude. And if we don't think of the larger community and not just ourselves, it will be darn near impossible to get through this. We are in a global society where, as you said, people are traveling to and fro. And if everyone is not on board to just clamp down and get this under control as we did before, it will be impossible to get through it. If we wait too long, then there'll be, and there are other variants out there. We know that, right? There's Lambda, there's other variants. They're just very, very low. They're not really causing a problem. But we don't want any of these variants to mutate more, become more virulent, to become more transmissible. Then we get to the problem, which the worst, the bad scenario is that the vaccines that we have may lose much of their efficacy. And we are back at square one. And the only way to get past this is vaccination. Yes.
Hello, Lisa. Thank you for joining us. So we're talking about a completely different beast, the COVID-19 virus. I was looking, Dr. Michelle, at some of the hotspot states, and we know that Florida is one of them. And it seems like they showed a map, and on the map, it had like all of the red was all of the states where the hotspots, where the numbers are surging in those states. And it seemed like they were like in the South, like a lot of them was down in the South, like Louisiana, Florida is down there, Kentucky. Like in those areas, it was like where the numbers were really surging and where we know that the vaccinations are not high.
Right. Yes. I mean, the areas where they're surging is where the vaccination rates are low. And that's because of, we started out talking about misinformation about the vaccines, right? But a lot of the politicians have gotten their vaccines, okay? And so we need to be sure that we're, again, getting the information from the right person and doing what is best for the community at large. Because you're right. Is it that they don't want the vaccine? In some of those rural communities in the South, are vaccines getting to those communities, right? There's poor rural South, and then, there's urban South. And there may be two different issues going on there, why those numbers are so high. But we're trying to get the word out that the vaccines are safe. Even, to all those communities, we're trying to get the politicians and the leaders to lead their constituents in the right direction to get their vaccine and wear their masks. I think we can get through this. If, the numbers are going up, even over the last week, they said that more people are getting vaccinated, right? I think they were up to about 900,000 vaccines in one day last week, whereas before it was much less. So I think that people are worried about this variant. They thought that we would be in a different place, and hey, let me just go ahead and do this. And so I know we're hoping that we get to 1 million vaccines in a day. We were close. I think last week I saw it was over 900,000 across the US. So hopefully those numbers will keep going up and we can see that curve go back down.
I know a lot of people were sitting back just waiting to see, what was happening with the vaccine, to see if people were having issues and stuff before they actually, got the vaccine. So now that they see this virus running around and multiplying, it's like, okay, I need to do something.
Right. Yes. I agree with you. I have a neighbor who the whole family has not been vaccinated, but now they're thinking about it. So you thought, right? We thought, oh, I'm just going to wait and, we'll get through and I'll be okay. But now we see that's not the case. Yeah, I think, and it's concerning because if you think about it, we've got 50% of the population in the US who we've said are already fully vaccinated, 70% who have at least one vaccine, and we're still seeing surges. That should tell us that this virus is very contagious. because as long as we still have so many people vaccinated, but we're still seeing these awful numbers, right? So it's almost like if you're not vaccinated, as they say, you just wait long enough and you'll get the Delta variant. That's kind of where we're at. So, and I think people are realizing that now, right? We can't think that it's going to pass me by. And that's probably causing the rise in the vaccine rates. So I'm hoping that continues.
Michelle said, how long would the vaccine be around?
Oh, it'll be around as long as we need it. They continue to work, develop, and bring out those the vaccines, produce them. I know that those companies, Pfizer, Moderna, Johnson & Johnson, they continue to look at how efficacious the vaccine is. Do we need to change it? Does it need to, be tweaked at all? Just like we do for, again, going back to flu. We look at what's coming out, what do we predict that flu virus is going to look like in 2021, they prepare the right vaccine, right? So as this thing continues, those scientists, those researchers are doing the work behind the scenes. So if they say, hey, we've got a change to vaccine, don't be surprised, that you might hear that next year, right? That, okay, we know now that this virus looks like this because it did mutate. Maybe you need to get another round of vaccine, just like we do for the flu vaccine. It's nothing different. This is what we do, right? If the virus changes, we change and tweak the vaccine to do the best job possible.
Dr. Michelle, what about those people that said, I have a strong immune system, so I don't really need to get a vaccine?
Listen, a strong immune system is great. We talked about that when this first started. I said, arm your immune system, get your vitamin D, get your vitamin C, be ready to be able to fight off this COVID. But a good immune system is not a cure. It is not a prevention from getting COVID. But we hope that if your immune system is well prepared to fight that battle, that you will not get a severe infection. But you should absolutely still be getting the COVID vaccine. Even if you eat plant-based, you take your vitamin D every day, you take your echinacea, you take all of that. Again, you may be fine if you get COVID, but maybe you're going to give it to your 10-year-old grandchild or someone who may not be so well if they get it, right? So we think about ourselves, but we also think about the people around us.
What about those people that say they already had the COVID-19 virus, so they have some antibodies in their system, so they don't need to get the vaccine?
Yeah. So the COVID, if you've had COVID infection, yes, you get a little bit of an immune response to that, but it's not as robust, doesn't last as long as the vaccine itself, right? So even if you've had COVID, we still recommend that you get the vaccine because the vaccine is going to give you more immunity. Talk to your provider about when you should get that vaccine related to your infection.
Michelle says she has a strong
immune system. And Michelle says, I have a strong immune system. She doesn't ever get sick, but that's great, Michelle. I'm thrilled. Okay. But I hope you get your vaccine. Okay.
Let me say this. I was one of those people that never get sick, never get a cold, never. And then somehow I ended up getting a cancer diagnosis. So somewhere my immune system was compromised to allow those cells to go rogue. So you still have to have that layer of protection on you. You still have to have it, regardless if you have a strong immune system. You still have to make sure, like you said, you're taking your elderberry, you're drinking, whatever it is that's going to help make it stronger. It could be strong, but sometimes it's strong and we still can get sick, not because you're not doing everything that you're supposed to do. Sometimes it just happens.
Yes, absolutely. I take vitamin D all the time. I'm always taking vitamins, and I was exposed to COVID and got COVID in October, right? But my symptoms were so mild. I did very well, and luckily was able to be here today to talk to you. So your immune system helps your body fight off that virus, but you still need that vaccine to get that boosted immune response. There's nothing like the vaccine. The infection gives you a little bit of immunity, and we know that immunity from the infection might last maybe 90 days, but not as long as a vaccine.
So some people may feel like because they may have tested positive for COVID, but they're like what is called asymptomatic. So they feel like, well, if I don't have any, if I don't have any symptoms, then, I'm not gonna pass it on to anybody because, I'm not showing any symptoms, but you still can.
Absolutely. You can still shed virus. Those viruses are in your respiratory droplets when you're talking, singing, shouting. Great that you don't have symptoms, but you're still able to transmit the virus to others. Again, another reason that everyone should get vaccinated, because there's people who could be walking around with the virus thinking that they are fine, but they're transmitting it to others, and then we never get through this.
Mm-hmm. Well, Dr. Michelle, can you give us some words of wisdom as it relates to this completely different beast, COVID-19, and then tell the people how to follow you, how to stay connected with you?
Yes. So you are right. This is a different beast, COVID-19. We've never seen anything like it, and it's going to take looking at things differently to really be able to move through this pandemic. We've never lived through anything like this before, right? Every 100 years we have a pandemic, and we're unfortunately in the middle of that. We know that vaccines work. They work for past illnesses that were public health emergencies, from polio, smallpox, and those things. And we know that they work. So I encourage anyone out there, if you're not vaccinated, to get your information from the right source. Talk to your doctor, talk to a second doctor, get a second opinion. Get all your questions answered. Don't make assumptions. Get your questions answered, and hopefully your fears and concerns will be answered, and you can get that vaccine to keep everyone safe. What we're looking to do, we've got to move through this. You can reach me if you have any questions, comments, put them in Facebook. I am Dr. Michelle's Healthy Life Solutions, or Doc Michelle on Facebook. Please, send any questions to me there.
Awesome. Thank you so much, Dr. Michelle. I appreciate your wisdom every single month. And I will leave you guys with these words.
Thank you. Thanks for having me.
You're welcome. I will leave you guys with these words of wisdom. Worry is like a rocking chair. It gives you something to do, but you get nowhere. So join me next Monday at 6 p.m. on Intellectual Radio. As always, thank you for tuning in to Warriors Talk with author and founder Lady ReShell, where we are changing lives one warrior at a time.
Thank you for listening to this week's edition of Warriors Talk with Lady ReShell. To find out more about Warriors Talk, follow at Warriors Talk, the number 1, on all social media outlets, and Warriors Talk with Lady ReShell on YouTube. Please join us next week and every Monday evening at 6 p.m. Central Standard Time on intellectualradio.com for Warriors Talk with Lady ReShell, where we encourage, educate, and empower you into action.